Yali Madad, everyone, and welcome to another episode of the Healthy Bytes podcast. Today, we're delighted to be joined by Shemin Mirali and Dr. Shahroz Merchant. Shemin Mirali has a wealth of experience within the institutions and within the Jamaat. She was an ex-Mukiani Ma at North London Jamaat Khana, served as chairperson of the Women's Activities Portfolio, and previous board member of social welfare, board responsible for social support. She has also helped set up cancer awareness support services within the Jamaat. And Dr. Shahroz Merchant is a consultant oncologist specializing in breast and lung cancer, and was also involved in cancer awareness and support within the Jamaat. Thank you both for joining us today. Shahroz, the current pandemic has affected the delivery of health services globally. How has COVID affected cancer care, and what measures have we taken to minimize risks to patients with cancer?
Yali Madad, Hafiz and Shemin. We're in unprecedented times in the medical world, and cancer poses its own challenges in this situation. And the way that I'm going to look at it from a cancer perspective is right from diagnosis through to treatment. From a diagnosis perspective, we currently know that screening for cancer has been paused across the UK. So screening for breast cancer, for example, such as mammography, bowel cancer screening with endoscopies, cervical cancer screening, these have all been paused. And we know that screening picks up cancer very early. And therefore, while these services are on pause, it is us as individuals to recognize cancer symptoms and report them to our GP. So if we're worried about any symptoms, then it's essential that during this time, we still seek the advice and support of our GPs. And I know that GPs are working in a slightly different way. We can't access our GPs as easily in terms of in person, but certainly GPs are continuing to offer virtual appointments. So if there are any concerns, then GPs are expecting us to call them. And we know nationally that there's been a drop in cancer referrals. There's been a 25% drop in cancer referrals. And this is worrying because we know that there are patients not seeking help, or GPs not referring patients in because of risk of virus. And I'd just like to highlight that actually it's really important that if there are any worrying symptoms, that these are addressed earlier rather than later, because the sooner we pick up cancer, the sooner we can treat it, and there's a more curative option for cancer. My role is as an oncologist in delivering cancer care, so treatments such as chemotherapy, immunotherapy, referring for radiotherapy. And the way that we've tried to work in this environment is by creating new networks of working. So we're working more collaboratively with other institutions. We've worked with advice from NHS England and NICE to provide us with guidance on how we can continue to treat patients. So we have to make very complex decisions for our patients. We have to talk to our patients individually about the benefit of continuing with chemotherapy or other treatments. So for example, we discuss with patients what their diagnosis is, what their treatment is to date, if they have any other medical conditions which might increase their risk of COVID. And then we talk about what benefit the treatment will have. And with every patient, we've had very individualized discussions about their treatment and about the risk of COVID. And how we've tried to minimize this risk for patients is cancer surgery is now being offered in what we call cancer hubs, such that we can minimize COVID exposure in these COVID negative cancer hubs. We're shortening or improving treatment times such that we're not patients are not attending as frequently for their treatments, so we're lengthening the gaps between treatments. And also we're providing what's called pharmacy drive-through services, where patients do not need to attend hospital to pick up their medication, for example. They can pick it up through pharmacy drive-through. So there are lots of tools and implementations in place that we can help minimize the risk of COVID risk while patients are attending for treatment.
Great. Thank you very much, Shahroz, for that overview. And Shemin, it's been a challenging time for those personally affected by cancer, and also for their friends and their families. How important is providing support in this current health climate?
Thank you, Hafiz. Yali Madad. Being diagnosed with cancer can be bring about a multitude of emotions like feeling worried, scared, sometimes angry or resentful, and vulnerable as well, which can affect your emotional state of mind. This in turn affects members of the family, friends, and colleagues, as it brings about changes in their lifestyle too. Sometimes, too much information can overwhelm someone suffering from cancer, resulting in confusion on the best course of treatment to take and where to seek help. At difficult times in our lives, especially in the current climate of restrictions on movements, we need emotional and spiritual support. We are fortunate to have Jamaati members and have Jamaati Mukhya Kamiyas who provide pastoral care as well as the institutions to support members of the Jamaat. However, it is not always possible to get one-to-one support on an ongoing basis. So this is where the Cancer Support Group comes in. The aim of the group is to offer practical and emotional support in a safe and confidential environment to Jamaat members affected by cancer, their carers, spouses, partners and children, as well as friends and colleagues. On occasions, we have also supported non-Ismailis.
Thank you, Shemin. That's very insightful. And Shahroz, what sort of health education do we provide patients who are attending for cancer treatment, such as chemotherapy, radiotherapy, and immunotherapy?
So we're trying to minimize the risk of patients coming in to hospital by, as I mentioned before, by reducing the frequency with which they attend hospital, providing drive-through services, etc. But when they do attend for treatment, we're advising them to wear adequate PPE, personal protective equipment. And by that, I mean advising patients to wear masks and gloves when they come in for their treatment, and also when they return home or when they leave the hospital environment, they wash their hands adequately, as has been provided with. We've had lots of information about correct hand washing, and also once they get home, I advise them to make sure that they change their clothes straight away, go for a shower or a bath, so that they're as clean as can be once they're in their own home environment. We've also doing what are called telephone clinics, so that patients are not needing to attend for hospital appointments. In addition, we've advised that patients continue to socially distance, so not meeting their friends and family, unfortunately. And finally, the government has provided a lot of information about shielding, and the patients that are at highest risk of being clinically vulnerable are patients on chemotherapy, immunotherapy, and radiotherapy. So these patients need to shield, and by shielding, it means they don't leave their house apart from attending for hospital appointments or really essential visits. So that's what we're advising patients currently on.
Thank you, that's really clear. And Shemin, you spoke of cancer support groups. Can you tell us a little bit more about your training experience?
The Cancer Support Group was trained by Macmillan's Cancer Support, which is one of the largest British charities and provides specialist healthcare, counseling, and information and advice on financial support available to cancer patients. It looks at the social, emotional, and practical impact cancer can have on cancer support on cancer patients, and it runs campaigns for better cancer care and works with the NHS to bring improvements to the service. Macmillan's have a cancer support helpline, which is open 7 days a week from 8 a.m. to 8 p.m. To give you some background on the Cancer Support Group, there was a drive by Macmillan's to bring about awareness of their services to the ethnic minority in the UK. In 2004, an Ismaili cancer survivor called a meeting with the aim of starting an Ismaili cancer support group, which would cater for the individual needs of the Jamaat and our community. At the time, she was supporting cancer patients, having been trained by Macmillan's herself. So this is how the Ismaili Cancer Support Group came about. We approached members of the Jamaat who we thought would be interested in being trained as volunteers. In 2005, Macmillan's provided training to 11 of us in the first group at North London Jamaat Khana. A second group of 15 was subsequently trained to cater for other Jamaat Khanas. As part of the training, we had to produce a portfolio on each of the 5 modules, which were cancer awareness, health and safety, introduction to counseling skills, communication skills, and loss and bereavement. We also had to keep a reflective journal on our learnings and experience. In addition to the Macmillans, tutors, and moderator, each of us had a mentor from the community who assessed our progress as the modules went by. And on completion of the certificate, we were awarded the Cancer Support Certificate, which is accredited by the Open College Network.
Thank you, Shemin, for providing that. I mean, it's really interesting to see how the support groups evolved over time. And Shahroz, looking into the future, being in the midst of COVID and beyond, where do you see the future of cancer services?
So I think there's been a lot of positive coming out of COVID. I know that it's a very bleak picture, but I think we're past the peak at this stage. And so we've got to start sort of planning for post-COVID era, really. And I think there's certain practices that have really improved the way that we deal with in certain situations. So, for example, telemedicine has become quite an important feature of our lives currently, and I think that it might be here to stay. So we know that we can, we don't necessarily need to have face-to-face outpatient appointments with our patients. We can do a telephone clinic, a video clinic. So that really improves, I think, access for our patients. Secondly, I think we've had a lot of collaboration with various institutions that we've worked with. So be it other hospitals, other cancer centres, NHS England, NICE, and I think that has provided an excellent educational opportunity. And we've learned a lot. We still have a lot to learn about how the virus is affecting cancer and what we can do in the future if such a situation arises. And finally, I think because there'll be a lot of backlog of cancer cases, I think health providers will need to look at how they're going to get through this backlog of cases. So patients from screening that still need to be screened, from diagnostic tests. So I think it will require really evidence-based and a comprehensive look at how we can integrate cancer services to build for the future and continue to provide a safe and effective pathway for all our patients.
Oh, absolutely. And Shara, just the way you described, from every difficult, challenging situation, there's always a silver lining. And Shemin, what role does cancer support groups play in our Jamaat?
Thank you, Hafiz. Jamaati Mukhi Kamrias, the health board, friends and family refer individual members to the group, but Jamaati members can also come to us directly. The kind of support we provide is face-to-face, over the telephone, or as part of a group. Obviously, the face-to-face and part of a group is not possible in the current environment. While we cannot provide professional counseling, we can give support and signpost. We provide information on local community services and emotional support to all age groups by listening, understanding their feelings of anger, frustration, or anxiety, ways of relaxing, and suggesting ways of reducing stress. So, for example, breathing and relaxation therapy, connecting with self-help groups to hear from others who are affected by cancer, taking regular exercises like walks in the park where you can observe the beauty of nature, trying a new hobby, making friends, and generally positive thinking. The support group is bound by a confidentiality agreement. So those who approach us can rest assured that without their consent, we will not disclose any information. We try to create an environment where Jamaati members are able to share feelings without being judged. For some, it has meant that they are better able to interact with their families, to know how to say certain things without hurting feelings, to be able to meet others who are experiencing similar feelings so they don't feel alone in their journey, being more understanding of challenges they face so they are better able to provide support. Members of the Jamaat, including men, women, and children, have valued the support we provide, and for some, this has been a lifeline. The support group also participates in Macmillan's fundraising events and has social get-togethers, so as to enable those affected by cancer to make friends, not feel isolated, and have some fun.
Absolutely. And finally, if I may, Shahroz and Shamin, do you have any final take-home messages to the Jamaat?
My final take-home message is to be more cancer aware. As mentioned previously, there is a significant reduction in the amount of cancer referrals to hospitals. As mentioned, there's 25% reduction in cancer referrals. And I think we're missing, quite a big population not attending for worrying cancer symptoms. And therefore, my take-home message is that while screening is not happening, and while, yes, we're trying to restrict our visits to hospital, it's really important that if you're unwell in a particular way, or you're concerned about symptoms, that it's really important that you seek advice of your GP. So, for example, things like weight loss, loss of appetite, any new lumps anywhere, any abnormal bleeding, a chronic cough. These are things really to look out for and really report to your GP, because we really don't want to miss the window of opportunity in picking up these cancers early, so that we can treat them early to ensure that there's better a curative outcome and better survival. So please see your GP if you're concerned. Thank you.
And I would really encourage those who would like to find out more to reach out to us, either come directly through your Mukhi Kamrias or the health board. And I would like to say a big thank you to those who have been involved. The dedicated volunteers were given their time and trained as support volunteers, to the Jamaati members who have participated in our functions and events, to our Mukhi Kamrias, the health board, and Macmillan's. Thank you.
Great. And once again, thanks to both Shamin and Shahroz for taking the time and sharing their insights with us. Thank you all for listening. Stay healthy, stay safe, and Yali Madad.
مولا جان دوستت دارم با همه وجود.
ما به خاطر اینکه ویروس کووید 19 بسیار خطرناک می باشد، ما با صحت و سلامتی شما بیشتر می اندیشیم. فلهذا آقا خان هلت بورد می خواهد برای آن ده جماعتی که برای وظیفه از خانه بیرون می روند چند نکته ایمنی را پیشکش نماید. اگر شما برای کار از خانه بیرون می شوید، لطفاً صورتتان را بپیچانید و هنگامی که با دیگران نشست و برخاست می نمایید، لطفاً ماسک بپوشید. بهترین راه نجات و وقایع از این ویروس فاصله گیری اجتماعی می باشد. حتی اگر صورتتان با ماسک پوشیده باشد، لطفاً 2 متر مسافت بین همدیگر برقرار نمایید. رومیزی های دکان، دستگیرهای دروازه و راجستر پول نقد را با مایع ضد عفونی کننده پاک کنید. همچنان چیزهایی را که در اخیر وظیفه با خود به خانه میارید، مثلا بکسک، کریدیت کارت، کلید و خصوصا تلفن همراه را با مایع ضد عفونی کننده خوب پاک کنید. تلفن همراهتان باید روزی چندین بار پاک شود. وقتی در وظیفه هستین، دستانتان را مکرراً برای حداقل 20 ثانیه خوب بشویید. اگر سطح چیزهای دکان را لمس نموده اید و یا با دیگران در تماس بوده اید، دستانتان را بارها بشویید. اگر دستانتان را با آب شسته نمی توانید، با مایع ضد عفونی کننده دستها یا هند سانیتایزر پاک کنید. وقتی دوباره به خانه برمیگردید، لطفاً بوتهایتان را بیرون از محوطه خانه بکشید و پیش از اینکه با اعضای فامیل در تماس شوید، شاور بگیرید. لباسهای وظیفه باید دفعتاً داخل سبد کالاشویی و یا داخل ماشین کالاشویی انداخته شود و با آب گرم شسته شود. اگر احساس مریضی میکنید، لطفاً به وظیفه نروید. تنها وقتی از خانه بیرون شوید اگر وقت ملاقات با دکتر دارین. با دکترتان در تماس شوید اگر علائم کووید 19 را در بدنتان مشاهده میکنید و یا علائم قبلیتان بدتر شده باشد. این نکات ایمنی را حتما باید در وظیفه دنبال کرد و این میتواند شما و فامیل شما را از ویروس کووید 19 حفظ نماید. تشکر و یا علی مدد.